The well.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is getting a lot of attention lately because of the results he's getting with his patients. So if you are missing one tooth or all of your teeth, and especially if you have a loose-fitting denture, my advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have an expert on the topic, Dr. Mike Golpa. Dr. Golpa.
Hi, Randy.
Welcome to the program.
Thank you for inviting me.
Before we get into today's topic, because I mean, you've developed a big name in Las Vegas. A lot of your advertising with cosmetic. Now you're transitioning, I guess, more into dental implants, or you've always done dental implants?
Well, I always done dental implant. It was both cosmetic and dental implants, so it's a combination of both.
So you've done a lot of kind of cool, kind of hip advertising, and now you're getting more involved in dental implants, or have you always been?
I've always done dental implants. You know, it was a combination of cosmetic and dental implants. You know, we're just trying to get the word out there that, you know, we are doing dental implants as well, and so for people who needs dental implant, you know, they could come to us.
Okay. Now, before we get into today's topic, tell us about your practice. I mean, what all do you do there? Well,
mostly we do full mouth reconstruction, cosmetic, and dental implants.
What is full mouth reconstruction?
Well, full mouth reconstruction is when the whole mouth is all the teeth are breaking down, and and it's a mess, you know, and you know we need to restore the tooth, we need to extract some teeth and replace implant and so forth.
Now, your office does not look like a dental office. In fact, I've visited dental offices nationwide. Probably by far the best I've seen.
I didn't want to make it like a dental office. I wanted to make it so when the patient comes in, they would be happy, they would be calm, relaxed, you know, and you know.
It's like a living room when you walk in.
Yes, sort of, right.
A big, you said sort of, in fact, I asked you, and you said, I was thinking about living here at one point.
I was thinking about living there, you know, I was trying to make it so, you know, in case I want to stay there some night, it would be nice enough for me to stay, so.
Now, your staff, a lot of pride in your staff, you say?
Yes, they've been with me for a long time, so, and they know exactly how to treat the patient.
So with all areas of dentistry, why the focus on dental implants for you?
Well, Randy, they're the happiest group of patients. You know, when you replace a missing tooth that the patient's been living without for the longest time, they're so happy. You know, you change people's life.
So who is the typical dental implant patient that you see?
Anyone that's missing a tooth. Anybody from a teenager to all the way to a 92-year-old.
Now, why would a 92-year-old want to get dental implants?
They want to be able to chew better. They want to be able to talk without having to worry about their denture coming out loose, or laugh without worrying about it.
Isn't that a bit old when I say for the procedure, for a surgical procedure? I mean, do they fall out?
No.
Really?
No. These implants these days are just, you know, in the old days we used to wait like 6 months before we could place a crown or attach the denture to the implant. Okay. These days are not like that.
Yeah, you say now, I have an ad of yours that says, no more dentures. Get a set of fixed teeth in one appointment. Teeth in one day. Is that right?
That's right. That's what I'm so excited to talk to you about, because this revolutionary technique has changed so many people's life. They can have teeth in one single appointment. In one appointment.
They have to be the right candidate, obviously.
98% of the people are the right candidate for it.
Take me through that process. I mean, somebody goes in, they're a denture wearer, they're watching this, and they want to say, okay, I want to see if I'm a candidate for this procedure.
A lot of patients, they self-diagnose themselves. They think, you know, they don't have enough bone, or they're not the candidate because they've been wearing this denture for such a long time. And everybody is a candidate for this procedure. The position of these implants have changed, therefore it allows us to place the implant without doing any type of a sinus lift or bone grafting, and with the new imaging system we could do the procedure before the procedure, so we don't have to open a flap, there's no suture placed.
So imaging has changed the way?
The new imaging system with the new imaging software that is out there, it's available to us now. We could go ahead and do all the plannings in advance and have the prosthetic, which is the teeth to be made before we do the procedure, because we know exactly where we're going to place those implants.
Okay.
And according to the study, we could go ahead and make the prosthesis.
The cap that goes on.
The cap that goes.
What do you call it,
onto
by the way?
Well, we call
Crown?
it. Well, we could call it bridge. You know, we could call it a fixed bridge that actually attaches to the implants. And that's what's so marvelous about this whole system, that we can do everything before even the patient gets there.
Now, we talked on the phone. You say how it's normally done, and make sure I have this right, is they go to one doctor, does a surgery, places the implant in the bone. Then they heal for a little while. Then they go to another doctor, usually, and that doctor puts the cap or the crown on top.
Yeah, usually that's how it's done.
Okay.
Usually, you know.
I mean, nationwide, is that how it's done?
That's how it's done.
Okay. You do both?
Yes.
Okay.
I do both.
What's the advantage? I mean, it seems like an obvious advantage.
Well, it's just basically we know exactly where we want to go. We're taking patient from A to Z, so you know we place the implant. We know exactly where we want to place it, and if it's a single tooth is missing or more than single tooth is missing, we know exactly where the tooth's going to go. So we place the implant accordingly, and there is no miscommunication between the oral surgeon or the periodontist with the restorative doctor.
Okay.
So everything gets done under the same roof, and we don't have to wait so long.
So the same day, help me understand. Okay, so
we place 4 implants in. Like
this is for a denture wear.
This is for a denture wear. If somebody is missing all their teeth, or if they have compromised teeth that's got to be extracted, we will go ahead and take the teeth that needs to be extracted. We'll take them out. We will place 4 implants, and right after we place the 4 implants, we already have the bridge made. We go ahead and I do have a model which I could show you.
Let me take a look at this. Okay,
Yeah,
so
sure.
This is a lower jaw, or is this upper?
This is the upper jaw.
Okay, upper jaw.
So
4 implants.
the implants are placed, and the bridge has already been pre-made.
Is that fixed? I mean, that
Then
stays in their mouth?
That is fixed.
Does not come out?
It does not come out. And
Now,
it gets
you say this was
on.
not available, like 3 years ago, or
No,
you didn't
it
know
wasn't.
about this?
This was not available. 4 years ago, this was not available, and there's not too many practitioner or oral surgeon who are trained to do this.
I asked a friend of mine, by the way, periodontists, and periodontists, by the way, great people, and I want to make sure that this is not taken out of context, because I've asked more than one. But one of them said, I don't think you could do it with 4. You need 6 or 8. What is your response to that?
Well, the beauty of these implants, they're different type of implants. They're much longer, and therefore we can apply more force to them. They're 4 times as stronger as a regular implant.
But the critics can say to me, and they said to me, in researching this, Randy, 4 is not stable enough. So what is your response to that?
It's definitely stable.
It is?
It is.
And it's because why?
Position of the implant, you can apply more force on the implant because of the position of it. And the beauty of it is we don't even get involved into the sinus, and there's no bone grafting. So whenever you do a bone grafting, then there is a longer period of waiting and healing and all that. So, and this is what has changed so many people's life. I mean, patient can walk in there and get their teeth in the same appointment.
You said dentures may someday be a thing of the past. I mean, you believe that?
Oh yeah, definitely.
Not an exaggeration.
No, it
so
will definitely
if it's as
happen.
good as you say it is, and I asked you that at your office, why isn't everybody doing it? I'm not clear on that.
Because a lot of people are not educated about their options. This is definitely a brand new option which is available for every patient who is wearing a denture or who is about to lose their teeth.
So take a look.
So
find out if you're a candidate. Do you meet these consults? They come in?
Yeah, they come in. I do the consult with them. They can go on our website. They can, there's patient education tapes that we got that they can watch.
How many people in Vegas you think are wearing dentures?
Well, I know nationwide is 38 million, but...
So in Vegas, I mean, 500,000 people, 500,000 people
least, yeah.
wearing dentures?
Yeah.
And you're convinced that if they knew about this, they would all do it?
If they knew about this, right, they would all do
Now,
it.
my
Because
mother-
a lot of people, a lot of patients, they think they need, like, they're missing 12 teeth on top. They think they're going to need 12 implants or 8 implants.
They count their teeth and say
They
this.
count their teeth. With this procedure, you only need like 4 implants, and you get their teeth on the same day.